Good afternoon, everyone, and welcome. My name is Darren Call, and I'm the Public Safety and Policing Policy Director here at the City of Kelowna. Before we proceed, I would like to acknowledge that our community is located on the traditional, ancestral, and unceded territory of the Silks Okanagan people. It is my distinct pleasure to welcome all of you to this fantastic milestone announcement today. And to welcome the Honorable Stephen Fuhr, Federal Secretary of State in Defence Procurement and the Member of Parliament for Kelowna. Amna Shah, Provincial Parliamentary Secretary for Mental Health Addictions. Mayor Tom Dias. See, they've done this perfectly for me. You see how, where did everybody end? It's perfect.
Trying to make it easier.
Well, we'll see if it still plays out this way. Mayor Tom Dias, of course, our mayor here in Kelowna. Councillors DeHart, Cannon, Lovegrove, and Stack. Thank you very much. So close. It's moving. Superintendent Chris Gable, RCMP, easily to recognize in the uniform, as well as Mike Gullick and Johnny Morris and their staff from Canadian Mental Health Association, both British Columbia and our local Kelowna office. As well, I want to welcome all of you who are standing in the room and outside the room. Special mention as well to Karen Olmanchuk from Interior Health. And of course, to my immediate right is my boss, Doug Gilchrist, our city manager here at the City of Kelowna. Today indeed marks a very, very special day for our community, and I'm truly honored to be a part of this exciting announcement. This initiative is a milestone. It's a milestone accomplishment that emerged from Kelowna's first ever community safety plan, specifically Action 1.2 in our plan. And it reads, to explore the creation of alternative community-based responses to police calls involving people of crisis. The Canadian Mental Health Association BC Division, in partnership with the City of Kelowna, and made possible, and this is extraordinary, made possible through funding from the federal government's Emergency Treatment Fund, as well as provincial funding and city funding, we are able today to launch the Crisis Response Community-Led Program, also known as CIRCLE. CIRCLE Kelowna, which will be delivered here locally by Canadian Mental Health Association Kelowna branch. CIRCLE Kelowna represents a significant advancement in our community's evidence-based approach to crisis response. By redirecting certain calls from the RCMP to a specialized crisis response team, the vision here is to free up valuable RCMP resources while also ensuring that people in crises receive the right response in the right manner at the right time. We are absolutely thrilled that Kelowna will be the next community in British Columbia to implement this innovative model, this evidence-based innovative model. And we look forward to working with our partners, our service providers, and our residents to ensure success. And so as your MC today, it is my pleasure to welcome to the podium and introduce the Honorable Stephen Fuhr, Secretary of State of Defence in Defence Procurement, and our Member of Parliament here in Kelowna. Please join me in welcome.
Good day, everybody. Thank you for the invitation. I too think it would be appropriate that I acknowledge that we're on the traditional and unceded territory of the Silks Okanagan people, and I want to acknowledge my elected officials and city staff and everybody in the background that the camera can't see. Thank you all for coming. This is an exciting moment, as was just indicated very eloquently. CIRCLE is a new way of doing things here in Kelowna, and I think it will change the way that we deal with the problem that we've had here for many, many years. For a long, long time, we've expected our police and first responders to step up and into every situation, no matter the nature of the call. They do outstanding work, but we all know that not every crisis fits traditional emergency response models. This new approach is about matching people with the help they need and when they need it. When some people are struggling with mental health, substance abuse, or other moments of personal crisis, they deserve a response that meets the moment. That's why this new Circle response, this is what it's built to do. They will show up with compassion, help de-escalate where needed, and connect people with supports that can make a real difference to them. They also help reduce pressures on emergency services so those teams can focus on the situations that they're really designed to handle. The Government of Canada is very proud to support this with a $1.5 million investment from the Emergency Treatment Fund. It's part of a national effort to respond to the toxic drug and overdose crisis that has touched every corner of this country. Through the ETF, we're helping cities like Kelowna build community-based solutions that reflect the realities people are facing on the ground. I also want to acknowledge the partners who brought this together. This is incredibly important and it doesn't happen very often. The province of British Columbia, the city of Kelowna, and the many community organizations and frontline workers right here at home. We all know that mental health and addiction are complex challenges. No single government agency will solve them alone. Here in Kelowna, we are proving that when partners line up around a common purpose, we can make real progress for the people that need it the most. As these Circle teams begin operating next month, we are not just launching a new service, we are strengthening the social safety net of this community. Thank you very much.
And thank you very much, Honourable Fuhr. I'd now like to welcome Anna Shaw, Parliamentary Secretary of Mental Health and Addictions with the BC Government.
Good afternoon, everybody. Maybe I'll just adjust this. There you go. I'm getting better at this. Thank you all for being here today. It's always a good day to come to Kelowna to celebrate such good news. Mayor Dias and I were reflecting on my last visit here to Kelowna, which was also good news, and so pleased to see smiling faces here today. Just want to acknowledge Johnny Morris here as well joining us. Great to see you again, and thank you to all of the councillors, Mayor Dias, MP Fuhr, and also Mike for joining us here today. I'm Anna Shaw, I'm BC's Parliamentary Secretary for Mental Health and Addictions, and I am honored to be here today on the traditional territory of the Syilx Okanagan people. And today is an important day for Kelowna, and I'm truly grateful to celebrate with all of you here today. Over the past few years, people across BC have faced a number of challenges, from the pandemic to the toxic drug crisis, to climate disasters, to global uncertainty. And these pressures have taken a toll on our collective mental health. And it's something that we see every day in our communities, our workplaces, our families, our friends. People are struggling and they need help. And we as a community have a responsibility to make sure that help is there when people need it. And that's exactly what Circle Kelowna is going to do. This initiative is the result of true collaboration between government and community partners. And with trauma-informed, culturally safe care, people will be met with understanding and with dignity, wherever they are on their journey. And through the dedication of compassionate health professionals, crisis situations can be de-escalated with empathy and with respect. Many of the people involved, being real, lived experience, they've been there. They understand and they can say, I know what you're going through. And sometimes that simple human connection can actually save lives. This approach also eases the pressure on police, on healthcare professionals and services, allowing them to focus on where they're most needed, while ensuring that people in crisis are connected to community services, supports, and meaningful pathways to recovery. So I want to express my deepest gratitude to the Canadian Mental Health Association for their collaboration and working with us to expand this model, and to all of our partners for their unwavering commitment to the people of Kelowna. Our government is committed to building safer, healthier communities across BC, and Circle in Kelowna is a key part of our Safer Communities Action Plan, which is a step forward in creating comprehensive, person-centered systems of mental health and substance use care across our province. So thank you again for everything that you're doing to make our province a safe, inclusive space for everybody. Thanks.
Mayor Dias, while you're standing, I'll now welcome you to Kelowna.
Well, thank you. It's a pleasure. On behalf of myself, on behalf of all of my council colleagues, and on behalf of the City of Kelowna, to be here today to launch the Crisis Response Community-Led Program. I also would like to spend a moment just to recognize Secretary of State and Honourable MP Stephen Fuhr, Parliamentary Secretary, who is here with us, our Superintendent, who is also here, Canadian Mental Health, who is alongside us, all of my councillor colleagues, and also the City Manager, and also Darren Call. I recognize that a lot of this work, and our social development team, a lot of this work which has been done over the years is getting us to a point where governments and also other forms of leaders look at the City of Kelowna as a place that they can bring offerings like this to be available to its citizens, and with confidence they recognize that it will be delivered. And we know that every community across the province has felt the impacts of mental health challenges and addictions. In one way or another, it has touched every family. We all know or know of someone who is definitely hurting. This initiative ensures that when someone is experiencing a mental health crisis, trained professionals are ready to respond with care and understanding. It means parents that are laying awake at night worried about their son or daughter will have another place to turn in a time of crisis. The Crisis Response Community-Led Initiative, CIRCLE, will connect people aged 13 years and older with experienced mental health or substance use crisis and trained professionals who can respond with care and compassion. These teams are made up of trained professionals such as social workers, nurses, EMTs, and peer support workers who have received over 100 hours of specialized training. This approach frees up our police officers, our bylaw officers, and firefighters to focus on crime and safety-related calls. Public safety, supporting mental health, and creating pathways to recovery are the priorities for this council. CIRCLE is one of the meaningful ways we are advancing this work. Since 2023, the city, we have invested in our frontline responses by hiring 31 new police officers, 15 new bylaw officers, and 14 new firefighters. Through our partnerships with the provincial governments, we have delivered 180 tiny home units that have already helped over 100 individuals within our community transitioning into more permanent form of housing, in finding their family, in finding work, or working their way back through interior health. And our social development team continues to work closely with community partners to address homelessness and social challenges by coordinating efforts and maximizing resources. CIRCLE will be delivered through the Canadian Mental Health Association, and Michael, we are very grateful for that. And I want to acknowledge the leadership and the work supporting people in our community that you do every single day. This new CIRCLE team is only possible because of the strong collaboration that my partners have spoke of today. Through the Government of Canada, through the Health and the Emergency Treatment Fund, the Province of British Columbia, and the City of Kelowna, And it is proof of what we are able to accomplish when all levels of government come together with a shared priority for the betterment of their communities. So to everyone who has worked to make this reality, to the frontline workers, the volunteers, the caregivers, and community organizers who show up every day with compassion and courage, thank you. You are saving lives, restoring hope, and helping our communities. Thank you.
Thank you very much. And never in my career did I imagine that I'd have the opportunity to share with all of you such a milestone event. 25 years ago in Alberta, I sat in executive boardrooms with police executive lamenting about the very challenge that we are here talking about today. And that is the inappropriate default to police as first responders. And so to that end, it's also my great pleasure to introduce our relatively recently announced officer in charge, Superintendent Gable, as our Chief of Police here in Kelowna, to talk about today's announcement and the significance for the RCMP. Please join me in welcoming Superintendent Gable.
Good afternoon. Thank you for having me here today. On behalf of the RCMP, I'm pleased to support the Crisis Response Community-Led Initiative. Our officers respond to a high volume of mental health related calls, and they do outstanding work every day in situations that are often complex and unpredictable. This program gives us another option for supporting mental health calls where a healthcare response is more appropriate. By working directly with mental health professionals, we can ensure people receive the right care and support while allowing our officers to stay focused on calls that require police involvement. This approach has proven very effective in other communities. We are glad to see it here in Kelowna. Circle strengthens our partnership with our healthcare providers, as well as other community agencies, and improves services for those in need. Our involvement in this program reflects our ongoing commitment to improving mental health resources and helping foster a healthier community. Thank you.
And thank you very much, Superintendent. So I'm keeping everybody on their toes by going out of order. And so now it's my great pleasure to welcome Mike Golick, who is CEO of Canadian Mental Health Association here in Kelowna, who I've had the great pleasure of working with now for a number of years. Mike, to the podium, please.
Darren, you talk about 25 years. I seem to recall, and we shared this conversation upstairs prior to this, the conversation that we've been having for the last 5 years. And the Action Team 1.2 that was created to create an alternative response to people experiencing a mental health crisis. One that was community-led, peer-assisted, trauma-informed, compassionate, and voluntary. Today is a significant milestone in this journey as we get to announce the launch of Circle Kelowna. On behalf of our organization, I could not be any more proud of our community to see this program come to fruition. At CMHA Kelowna, our vision is to create a mentally healthy community. It's a simple statement and a clear vision, but making that vision happen, as we know, is often not so simple. Building a mentally healthy community takes time, requires partnerships, strategy, financial support, and a whole bunch of other ingredients that we found in this room today. When I look around and I see the support from multiple levels of government, I see what is possible when we truly work together. I want to start by thanking the City of Kelowna for their bold leadership and believing in, advocating for, and financially supporting a better way to support people in crisis. In addition, I want to thank the Government of Canada and the Province of British Columbia for their funding support to make Circle Kelowna a reality. I also want to send a shout out to CMHA BC Division, who pioneered the Circle model and is supporting us in the launch in our community. Thanks to Johnny and team. Finally, when I look around this room today, I want to acknowledge those here today from our team. The superheroes in disguise with clinical and lived experience, who will be delivering the service with care and compassion. An example of innovation in action with life-changing and in some cases, life-saving results. Thank you.
And thank you to everyone who over the last 4 or 5 years have worked tirelessly to bring this vision to reality. Special mention to Colleen Cornock, Casey Zimmerman, Leslie Driscoll, who were part of that original group back in 2020, 2021 to carry this project forward. We wouldn't be there, we would not be here today without their unwavering belief and tireless work here at the City of Kelowna. And with that, it's my great, it's my distinction to again thank all of you and as our community, as we together are dedicated to building a safer and more compassionate community. And only when we do that can we truly, truly make a difference with initiatives like the one announced today. Thank you all very, very much for coming, and this concludes our event.
No, Ren takes her.
Was you gonna do it from the podium or one-on-one? I got a question for you, Mike. Yeah.
Hard to get in. Now we're hopping this camera here. Perfect.
I'm starting to make another
We got that one.
1, 2, 3, thank you.
You know, I did yesterday, but like, all right.
Perfect.
Did someone get it?
Redo it.